Against COVID-19, the Human Science Research Council, in partnership with the University of KwaZulu-Natal, is conducting a survey looking at how COVID-19 is impacting on health workers. Well, for more on this, we cross to our reporter, Sipho Stuurman, who's standing by for us in Centurion. Thanks very much for joining us, Sipho. So what can we expect from that report? What does it say?
Well, a very good afternoon to you and our viewers at home. You're quite correct. The HSRC is launching a survey of health workers that are in the front lines trying to treat COVID-19 patients. And of course, they're trying to understand the impact of COVID-19 on health workers physically and emotionally. Now, we understand the survey is just being launched today as we speak. And to get clarity as to what are the goals, what are they looking at, and what they hope to achieve with this report, I am joined by Professor Kangelani Zuma from HSRC, who's going to explain a bit into detail as to what they're hoping to achieve here, because of course we know COVID-19 is a fairly new disease, and there isn't a lot of knowledge around it. Sir, thank you very much for joining us this afternoon on SABC News. You've launched this health survey for health workers, this survey for health workers, to try and understand the impact of COVID-19. Talk to us about what motivated or what inspired HSRC to go on this survey for health workers to try and understand the impact of COVID-19.
As you know, that health workers are at the forefront of the epidemic. They are the people who are actually at where things are, the epidemic is really evolving. What we are doing in this study, we have seen anecdotal evidence that speak to the challenges that health workers face as they do their work. We have sought to conduct a study which will get information about exactly what is it that is happening, to get to know about the challenges that the health workers face. And when we talk about health workers, it's not only the nurses that we're talking to, it includes everyone that works in the health systems, be it the doctors in different specialties, including also, for the first time in this study, we include also people who are the support staff, the security workers, the cleaners, and everyone that is working the health systems, so that we get to understand a number of issues, including the knowledge among nurses themselves or health workers in general about the epidemic, the training that they have, whether the training that they have is adequate enough to deal with the epidemic, and where do they think that there are challenges, or where do they think that there are gaps in terms of their knowledge. And also another important issue that we're looking at is the infrastructure that they have, that they use to protect themselves, the protective personal protective equipment that they use. Do they have sufficient? Do they know how to use them? Are they available? And all those issues around that are covered in this very detailed questionnaire that we implement.
All right, now let's talk about how this is going to be conducted. How is it going to be implemented? Is it going to be online? And have you communicated with professionals in the health sector? Is there an interest to participate in this survey?
The study is done together with its Human Sciences Research Council, doing the study together with Nelson Mandela School of Public Health at UKZN. We have contacted and working together with health professionals affiliation. We correctly put it, the study is conducted online, and therefore we are able to put the link to every area where our health workers are accessible. We work with the Department of Health to actually implement the study, and many other agencies that are involved in the health system will have access to the link and be able to distribute.
How long is this study going to take, and what are the key areas or themes that you are looking at particularly? I know you mentioned that the understanding of this COVID-19 disease, and also understanding also how the health professionals are protecting themselves. So, but are those the key themes? Understanding of COVID-19 and how health workers should be protecting themselves, and how long is this going to take?
The study will take, this is a short survey. In a week, the results should begin to be available, that we can make available, and they will feed into the command center, so that as we take decisions and move on to take decisions about how to deal with the epidemic, this information information will be readily available. Also, over and above the perceptions or the attitude that we get information on, we also get information about what are the gaps that health workers that they see that actually should be taken into account as we deal with the epidemic. What is it that we should do differently, or what is it that we should do more of what? So we will be getting that information right from the people who are at the center of the epidemic.
And also, you've mentioned something interesting, that you're including security personnel. That's also part of essential work that is obviously providing security services at hospitals. You're including administrative staff. So it's quite comprehensive, that it's not just the health workers, but also the support staff as well. Why is that important?
It is very important because the security or the support staff themselves working in the health systems, these are the people who also interact with people who come to the health facility. Do they know how to protect themselves? Do they know how coronavirus is transmitted, so that they are able to protect themselves and those that are around? Are they able to deal with people that are coming to the facility when they are coming to seek health for whatever reason that they come to the facility?
And just finally, you mentioned that it's a short study and results should be available in a matter of a week. But talk to us about what are you hoping to achieve with the outcomes of this study? And I imagine that I will be coming back to find out what are the results and what have you learned from this study?
Certainly, we hope to get to know about what is it that actually is really happening in the health facilities. How should we deal differently with the epidemic? Are our health workers equipped in terms of knowledge? Are they implementing what they've been taught to implement to prevent the epidemic? And what is it that should be done differently if we are to win the fight against this epidemic?
Professor Zuma, thank you very much. That is Professor Zuma from the Health, the Human Sciences Research Council, talking about this survey that has been launched for health workers to try and find out the impact of COVID on health workers, both physically and emotionally, but also interestingly, support staff are also being included in this. So it's a comprehensive study that's going to actually identify gaps in the country's strategy as we try to fight the spread of the coronavirus.
Thanks very much, Sipho, for that report.